Hello, and welcome to the UC Davis School of Medicine and to the Sacramento region. My name is Eileen Wetzel. I'm the Chief Executive Officer of the Sierra Sacramento Valley Medical Society. It is my pleasure to welcome you to the UC Davis School of Medicine and to your free membership in SSVMS, the California Medical Association, and the American Medical Association. We are grateful to UC Davis for their sponsorship of your membership in organized medicine for all of your 4 years of training. So what is the Medical Society? SSVMS is one of the oldest and largest medical societies in the United States. We have been in continuous operation for 153 years and proudly represent over 6,000 physicians and medical students in the Sacramento region. Our mission is to bring together physicians from all modes of practice to promote access to quality medical care, to protect the public health, and to enhance the physical and mental well-being of our entire community. Some examples of how we do that are protecting the public health. SSVMS and CMA tirelessly advocate for the protection of the public health at the local and the state levels. I'd like to share with you a few examples of our advocacy. We've taken on big tobacco. In 2016, we successfully sponsored a ballot initiative that increased the tax on all tobacco products. This initiative generates over $1.2 billion in funding every year to support smoking cessation programs and to increase funding for Medi-Cal, California's Medicaid program for low-income residents. Significantly, the tobacco tax initiative has also allowed us to provide over $25 million a year in medical student loan forgiveness for physicians that commit to providing care to low-income Californians. SSVMS and CMA also took the lead on passing legislation sponsored by Senator and Dr. Richard Pan to ensure that children are fully immunized against preventable diseases such as pertussis. Here in the Sacramento region, SSVMS is addressing the opioid crisis that many communities are experiencing, including our own, through our RX Safe Physicians program. Through that program, we promote safe prescribing guidelines and access to naloxone, patient education on opioids, and on alternative pain treatment options, in addition to resources for addiction treatment. We care about the public health and protecting our healthcare workers. That is why SSVMS raised enough money, sourced, manufactured, and donated over 30,000 face shields and masks to physicians and medical students on the front line of fighting COVID. We are tireless advocates for the medically indigent and the uninsured members of our community. Through the Medical Society's Spirit program, our local physicians and health systems have donated over $11 million in care to those that need it most. We work very closely with this program with the UC Davis student-run clinics and accept your referrals for patients that you see that need donated surgical services, and we enjoy that partnership. Additionally, legislative advocacy is something that we are very involved in here at SSVMS and at CMA. As a medical student member of SSVMS and CMA, you will have the opportunity to meet with elected officials, such as our very own Dr. Richard Pan, who is a state senator, and Dr. Ami Bera, who serves in the U.S. Congress. We invite you to join myself and other leaders of SSVMS as we meet with these lawmakers and advocate for issues that are important to physicians and to the patients that you treat. We ask that you get involved, and how you get involved in organized medicine is entirely up to you, and it depends on what you are personally interested in. You may want to attend CMA Legislative Leadership Day or participate on an SSVMS committee or council. Perhaps you're interested in working with SSVMS staff on healthcare policy development, white papers, or even research projects. You may want to consider a role in your medical student chapter, a leadership role, or to attend the CMA or AMA House of Delegates. Ask yourself, what are you passionate about? And then reach out to your medical society, to us, and let us know how we can connect you. Finally, as you enter your medical career, we really hope that you take the time to take care of yourselves. SSVMS created a nationally recognized Joy of Medicine program, which focuses on the issues of medical student and physician burnout. We care deeply about you and have produced resources and services that will help you as you continue your journey. I invite you to visit joyofmedicine.org, our website. There is a dedicated medical student corner where you will find videos, a resource library, and be able to listen to podcasts that feature physicians from our local community as they talk about their journey to becoming a doctor, as well as how they are discovering the joy of practicing medicine. Again, it is my honor to welcome you to Organized Medicine. Your membership in SSVMS, CMA, and the AMA is sponsored by UC Davis. Now, I'd like to turn this over to our medical student leaders.
Hello, everybody, incoming MS1s. My name is Cameron Clerkley. I am currently at MS2 here at UC Davis School of Medicine, and I'm one of the co-presidents of Organized Medicine. And I'm here with my other co-president, Surgeon, and we're just going to give you a brief intro about our student interest group. Essentially, because of the pandemic, a lot of our in-person activities were cut short. So we're still going to have our older presidents from last year present on a lot of the other opportunities that you can do. But for us, we're just going to talk about kind of why we joined. And I joined because I had a passion for health equity and trying to figure out what was wrong with the system in healthcare. And I have zero experience, but that doesn't matter because I was still elected as one of the co-presidents, and between me and Surgeon, we recruited a board, and we're here learning so much about the field of health policy, health advocacy, about different types of policies that go on in medicine and what they mean, and just the terminology, and staying up to date with current events. So Surgeon will give you some ideas of how you can get involved as a board member. But even if you don't want to be a board member, we're still an organization that you can get involved with, and there will be plenty of opportunities to do that.
Hi everyone, my name is Surgeon Moore, and as Cameron mentioned, I am the co-president for Organized Medicine. What we started doing this year that was different from other years was our own health policy newsletter. So every single month we would all get together and decide what was new and happening in the health policy world, and put it in a newsletter and send it to everyone at UC Davis. This project was very successful and is still ongoing, so you can be a part of that. And another thing that anyone joining Organized Medicine can do is create their own course on health policy. If you're someone who has a lot of experience and wants to start something like that, we are definitely there to help you. Just reiterating that Cameron and I joined because we were very eager about this. It's not because we had a lot of experience, and we've learned a lot through this process. So now we can say that we actually know a lot more than we did when we started. If we want to start a bill or get involved with people at the Capitol, these are all opportunities that are accessible through Organized Medicine. And we have our new board members listed at the end of the presentation that you're going to see. Their emails are there as well, so feel free to contact any one of us if you have any questions. And Cameron and I are looking forward to seeing you guys.
Yes, so we look forward to hearing back from y'all, and enjoy the rest of the presentation. Thank you.
Hello everyone, my name is Angelica Ramirez, and I am the co-president of the Organized Medicine Student Interest Group, or SIG, here at UC Davis. Let me first start by congratulating all of you on your acceptance. You're all going to be doctors. So let me tell you that is very impressive. It is so impressive that a whole organization, Organized Medicine, exists to make sure that your voice is heard. So I'm here to tell you a little bit more about our Organized Medicine SIG and to get you excited to sign up. To give you a little bit of background, it's important to know that physicians have a couple organizations that they're part of to advocate for certain laws or regulations to be passed at the county, state, and federal level. Our local physician organization here in Sacramento is called the Sierra-Sacramento Valley Medical Society. Our state organization is the California Medical Association, and our federal organization is called the American Medical Association. As the Organized Medicine group here at UC Davis, we interact with all of these organizations and have a say in the policies and laws they support or push for. So that's really impressive, and it's also very important. In addition to that, Organized Medicine holds events and lectures like our Lunchtime Lecture Policy Series, where we bring in individuals working in the community or in politics to talk about their work. And this year, we'll be starting a new course called First Aid for Health Policy, where we'll be breaking down what health policy is, the structure of government, and other important information background into very, very simple, basic terms. So we're really excited about that. Lastly, we will hopefully give all of you the opportunity to practice your new advocacy skills when we join the California Medical Association on their Legislative Advocacy Day to talk to the state assembly members and senators. So students look forward to this every single year. So hopefully we can do that next year. I know that this is a lot to take in with everything else thrown at you right now. So Zena, the other co-president, will give you more information about the activities we participated in last year, and we just have one ask for all of you. Please make sure to sign up and get your awesome gift. When you get sent the form by Darylyn or someone else, just make sure that you fill it out and submit it. Layla, our representative for the local medical organization, will talk to you more about UC Davis's annual goal of getting 100% participation from every class. And participation, meaning you fill out the form, it's completely free. You become a part of the California Medical Association, American Medical Association, and the Sierra Sacramento Medical Society. And you get an awesome gift. And Layla will talk to you more about that. So once again, congratulations. Feel free to reach out with any questions, and I hope that we can count on your voice to help advocate for a more equitable healthcare system. Thank you.
One of the things that makes Organized Medicine a great organization for medical students to get involved is its flexibility. There are endless opportunities associated with Organized Medicine, but your level of involvement is based on how much you can take on and what's conducive with your schedule. Being part of Organized Medicine gives students opportunities to exercise their leadership skills and also build on their knowledge base regarding important policy related and public health subjects. On the next slide, you can see the CMA holds an annual meeting, and it involves the California Medical Association House of Delegates that come together and establish policy on current major issues. Past issues have included healthcare cost containment, single-payer physician supply, maintenance of certification, mental health, opioids, and developing a 5-year public health plan. As medical students, we do have a strong voice, and we meet before each House of Delegates meeting. We write up resolutions, which are modifications of current law, and then we present them to physician delegates with the potential of our propositions being implemented. As the leadership board, it is our job to engage the student body and share knowledge regarding policy and public health. Throughout the academic year, we organize events and lectures on campus. Last year, we held a primary election discussion and presentation to encourage informed voting. So the presenters were members of the board, and the event was open to everyone. We presented on frontrunners in the 2020 primary election, local policymakers in the running, and current measures that would be offered on the ballot in a completely unbiased and informative way. And our goal in this organization is not to sway people to make specific decisions, but to offer the information and leave people to formulate their own opinions. On the next slide, this one is basically going over conferences that we have access to that are open to medical students. There's a number of conferences that you can attend throughout the year. One of the biggest is the Medical Student Advocacy and Region Conference in Washington, D.C. This is where we choose 3 major issues to discuss as a group, and then we get divided into smaller groups to present to legislatures from our region. The conference also involves presentations from medical doctors in Congress, so it's a great learning and network experience as well. Next, Leg Day is also another great opportunity to get involved in for medical students to champion healthcare legislation and advocate for important issues that affect our education, our future as physicians, and our future patients. This year, it was virtual, however, it was still very productive. The schedule was modified to include current issues such as police brutality. In the photo, you can see myself and a group of other medical students from Region 1 on a Zoom call with Senator Duranzo. She was extremely receptive to our opinions and knowledge and committed to continue working with us as they modify current systems. So as you can see, this organization has a great deal of influence, and it's a great opportunity for individuals to begin making a difference as medical students.
Hi, class of 2020. My name is Layla Farshidpour, and I am your SSVMS representative for the class of 2019. I just wanted to take this chance to tell you a bit about SSVMS and then also kind of recap what Zena and Angelica said about joining organized medicine. So SSVMS is the local medical society in Sacramento, and they represent about 6,000 physicians in the area. And over the course of the past year, it has been a wonderful experience working with them because you get to learn a lot about policy, you get to learn about local advocacy, and really see the inner workings of medicine and what leadership in medicine looks like. I think for any of you that are interested in policy later on in your career or are really new to this and just want to learn how to be an effective advocate for your patients and for your profession, I think that this would be a great opportunity for you. I think over the course of this past year, I have seen SSVMS be a physician advocate through the work that they did on the No on Prop 46 initiative, and I've also seen them work very tirelessly during the COVID-19 pandemic to make sure that the physicians and the medical facilities in the area have what they need to take care of their patients. I think that overall, organized medicine is a good opportunity for anyone that's interested in policy. I think that it's a really good chance for you to go to conferences and various events and learn and network and seek mentorship like Angelica and Zena were talking about earlier. I think it's also a really good chance for you to interact with medical students from across the country and also locally and learn more about some of the work that they are doing in their different cities and towns. This last slide has some of our contact information. So if you are interested in any of the positions that we talked about today, and if you want to know more about what being part of organized medicine entails, please feel free to reach out to any of us. We would love to hear from you guys. And if you have any questions about Block 1 or medical school in general, we would also love to answer those as well. We want to wish you all the best of luck with Block 1, and definitely do not hesitate to reach out to us if you have any questions. And best of luck. Bye, guys.
Thank you for your leadership. On behalf of SSVMS, CMA, the AMA, and your medical student leadership, welcome to Organized Medicine. Be well.